Okay, so Joseph said details. Actually, it's not testing detailed listening. Detailed listening would require you to understand every single word which was being said as you were listening. For example, like an instruction manual. If you don't understand every single word of an instruction manual, you're not going to be able to operate the piece of equipment. But this isn't the same thing. This is, yeah, and Anita has said it here, it's specific information. That is what is being tested. You're being tested on being able to pick out specific words and phrases as you listen. That takes us back actually to some of the other tips that I've looked at previously, because if the test is on specific information, what you then need are, let's go back to number 3, the words that relate to your predictions. So you've looked at the gaps, you've made those predictions, Afida's saying it as well. Yeah, it's the key words. You've made predictions on keywords, and what you're listening for is to see if those keywords come up or if something similar to those keywords come up. So the example we were looking at before, we were looking at a noun, possibly a disease, possibly symptoms. What we should be listening for at the beginning of that interaction is when the patient starts talking about the disease that they have or about the symptoms that he or she has been experiencing. So those are the key words. If we don't get every single word as we're listening, we've got to ask ourselves the question, well, do I actually need every single word? And the answer to that question is no, not necessarily. As long as you get the keywords that you need, which help you to fill those gaps, then you've achieved that goal that you need to achieve for listening part A, which is listening for specific information. So